Now we're scanning the abdomen, mainly liver, from epigastrium by using convex probe. As in a previous scan, there is a hepatic cyst or abscess. This is left lobe of liver, which shows normal texture, no mass lesion seen. This is pancreas, which is also normal. Now rotating the probe from epigastrium to the right hypochondrium to scan the pathology in right lobe of liver. Here we see the right lobe, which also normal and no mass lesion present. Now we sliding the probe from epigastrium to the right hypochondrium between the ribs to find out the abscess or cyst which is present in the previous scan. Here we see a well-defined rounded lesion which shows heterogeneous texture with internal echoes. This is cyst containing debris and fluid with a well-defined thin wall. But when we see the texture of liver, we see no surrounding edema or inflammation. Now we will rule out the origin of this lesion. As when we scan from epigastrium, the liver was normal and this lesion was not seen in the liver. But from right hypochondrium, it is seen below the left lobe of liver. And this is right kidney, which is also normal and not connected with the lesion. Now we will scan the gallbladder, which is partially contracted and no mass lesion present. Now we will measure the volume of this lesion. The volume of this lesion is 290 milliliter. Now we continue scanning the lesion from right hypochondrium to the right lower abdomen to locate the origin of this lesion. Here we see the ascending colon, which contain gases. This lesion lies posterior to the ascending colon. Now we will change the convex probe to linear probe to scan the ascending colon. Here we see the walls of ascending colon are prominent and here we see the gases. Now we continue scanning the ascending colon from right hypochondrium to the lower abdomen towards the cecum. Here we see the walls of ascending colon are mildly inflamed in the middle part. The hypoepiclean is muscular propria, which is thickened and inflamed, and below this echogenic is submucosal layer. Now continue scanning to the cecum. Here we see the cecum where the submucosal layer is inflamed and thickened and echogenic. The wall of cecum are inflamed, mainly submucosal layer, and also full with gases. Now we will find out the appendix. Here we see the tissues around the cecum are inflamed and echogenic. Here we see the appendix, which contain fluid and debris. And here we see it is connected with the lesion. Here we see that this lesion is arising from the appendix and continuous posterior to the ascending colon to the right hypochondrium and give appearance as hepatic cyst. The patient is feeling very pain and tenderness at the right iliac region due to this lesion and inflamed appendix. Now we will measure the anterior posterior diameter of appendix. The anterior posterior diameter of appendix is 12.5 millimeter and the normal size is up to 6 millimeter. Now again, by using the convex probe, we will scan the pelvis to see any collection or fluid. There is no collection or fluid present in the pelvis. Now how we will write report.